Hello, my name is Shahrzad Shariat Panahi. I am a first-year PhD student at the University of Edinburgh studying biomedical engineering, biomechanics, and I'm excited to present my work titled From Fracture to Fixation, Innovative Methods in Understanding and Improving Orthopedic Implants. Now, just a little bit of background. A periprosthetic femoral fracture, or PFF, is when the bones surrounding an orthopedic implant fractures. Now this here is called Vancouver Classification System, or VCS, classifying different types of fractures, or PFFs. These fractures are currently the leading cause of failure in total hip arthroplasty, or THA. Traditionally, the response to such fractures has been revision surgery. That is a full replacement of the prosthesis using a longer, perhaps larger stem. However, there is increasing evidence that anatomical or open reduction and internal fixation, also known as ORIF, can be more effective, less invasive, and more cost-efficient, especially in cases involving cemented femoral stems. Now, about the problems and limitations, despite their frequency, our understanding of the biomechanics of periprosthetic femoral fracture fixation around cemented stems remains limited. This lack of biomechanical insight restricts the ability to standardize treatment approaches, making outcomes unpredictable and unfortunately often suboptimal. Now let's look at some of the innovative methods. To address these challenges, there are several innovative technologies and methods that I am interested in and wanted to share with you today. Let's start with anatomically contoured plates, which are the new generation of fracture fixation plates. This here is for comparison. And these new generation of plates fit in with intricate anatomical geometries. Next, there are specialized options like polyaxial screws, cables that function with fracture fixation plates and screws. There are also wires and cartilage cables, as the one you can see in this picture. These were all developed to assist surgeons to fix any fracture patterns. This here is called Unified Classification System. So these innovations accommodate fixation of diverse fracture patterns. And let's look at the last two together. That is fracture fixation plates and screws. And there are two main concepts. Dynamic compression plates, or DCPs, on the left, and locking plates on the right. And some plates give you the option of both these systems combined, as you can see in the middle. But basically, dynamic compression plates, or DCPs, and locking plates are both used to fix fractures, but they function differently. DCPs rely on the compression between the plate and bone achieved by the screws tightening to provide stability, requiring good bone quality for effective fixation. In contrast, locking plates have threaded screw holes that allow screws to lock into plate, creating a fixed angle construct that doesn't depend on bone plate compression. This makes locking plates more suitable for osteoporotic bones, where bone quality is poor or fragment stability is difficult to achieve. These tools help orthopedic surgeons to fix a wide range of fracture patterns using different fixation options, increasing the reliability of the construct's stability. So about my research, I decided to look into failure of cemented stems because that is the most common method that surgeons would use when performing a total hip replacement in the UK, as you can see here, based on the information reported in the most recent National Joint Registry report. So in these cases, the surgeon has used a material that is called bone cement. Also, as I mentioned before, periprosthetic fracture is the number one reason for implant failure after total hip replacement, as you can see here. So far, I've built a detailed digital model of a cemented hip stem that is called a PTS, or polished taper slip stem, and particularly my design is based on Stryker Exeter V40 stem. That is the most commonly used stem in the UK right now. Inside a femur bone using CT and 3D scanning and SolidWorks. Then I ran simulations in Abacus software to see how the structure handles real-life forces when walking. Here are my initial results. As you can see, the von Mises stress reached a maximum value of 230 megapascals at the identified critical point under the neck of the femoral stem. Comparing it to the yield strength of this particular type of surgical grade stainless steel, the stress level is less than the material's yield strength, which is brilliant, as this shows that the stem would function well and withstand the load no problem. Next, at the bottom, the maximum principal strain in the bone, that is cortical and trabecular bone, and bone cement across 7 different grunt zones is shown. The maximum principal strain is mostly concentrated in the lateral and proximal zones, particularly zones 1, 2, 3, and 7. Moving forward, I'll be upgrading my model to include a fracture and fixation plate, and then I'll be running the analysis again. And last but not least, we have impact, and the impact of my research would be better understanding of the bone, bone cement, femoral stem, bone screws, and fracture fixation plate constructs mechanical interaction to provide orthopedic surgeons an optimized approach to treat periprosthetic fractures. Thanks for your attention. I'd be happy to discuss the methods, simulations, or clinical relevance, or any other questions you may have during or after the poster session.